So now coming to the next topic, that is neuropathies. Neuropathies, there is inflammation or degeneration. There is inflammation or degeneration of peripheral or cranial nerves resulting in impaired conductivity of these nerves. Okay, now in neuropathies there is inflammation or degeneration of the peripheral or the cranial nerves, which resulting in impaired conductivity of these nerves. Okay, well, peripheral or cranial nerves, they get degenerated, leading to impaired conductivity of these nerves. Now, peripheral nerves normally they contain motor neurons plus sensory neurons plus autonomic neurons. Okay, peripheral nerves they contain motor neurons, sensory neurons, and autonomic neurons. Now in pure motor neuron lesions, they result in weakness. Now, in neuropathies, how they are not peripheral nerves, neuropathies, what peripheral nerves, pure motor neuron lesions, they result in weakness. Okay, more in distal region than in the proximal region. And lesions result in weakness more in distal region than proximal region. And they result in flaccid atrophy, and hyperplasia. And they result in flaccid atrophy, fasciculations, and hyporeflexia. Normal neuron lesions, they result in weakness, which is distal more than proximal, flaccidity, atrophy, fasciculation, and hyperplasia. In normal neuron lesions, there is weakness, okay, flaccidity, atrophy, fasciculations, and hyperplasia. Obviously, there is going to be like atrophy of the muscle, okay, atrophy will lead to flaccidity and hyperplasia along with weakness plus fasciculations. Now coming to sensory neuron lesions. In sensory neuron lesions, which are more distal than proximal, can develop. What are the important symptoms we have? Neuropathic symptoms, in sensory neuron lesions, positive symptoms, and negative symptoms. In sensory neuron lesions, we have positive symptoms and negative symptoms. Positive symptoms, they include pins and needles, okay, pain and burning sensation, pain and burning sensations. In positive symptoms of sensory neuron lesions, they include pins and needles, pain and burning sensations. In negative symptoms, they are like loss of sensation. Now the positive symptoms include pins and needles, okay, pins and needles, pain, default positive, default pins and needles, default pain, and default negative burning sensation, negative symptoms, loss of sensation. Now coming to autonomic neuron lesions. They can cause autonomic neuron lesions, they can cause pseudomotor disturbances and trophic changes. They can cause pseudomotor disturbances and trophic changes like sweating, near atrophy, and hair loss. Okay, in autonomic neuron lesions, these can cause pseudomotor disturbances and trophic changes. Pseudomotor disturbances and trophic changes, trophic. Okay, in trophic they can be sweating, flushing, pseudomotor related to glands, such as glands, and trophic changes, skin changes, like sweating, flushing, near atrophy, and hair loss. A classification of neuropathies. Now coming to the classification of neuropathies. Neuropathies, the classification. First of all, it can be based on number and distribution. First of all, based on the number and distribution. They can be mononeuropathy, singular, polyneuropathy, or mononeuropathy multiplex. Okay. Based on the number and distribution. Okay. Neuropathies. It can be mononeuropathy involving a single nerve, and polyneuropathy. Diffuse involvement of all multiple nerves is seen in it. Diffuse involvement of all or multiple nerves is seen in it. Example, diabetes mellitus, GBS, and CIDP. Okay. So polyneuropathy, diffuse involvement of all or multiple nerves. Okay. These are seen in diabetes mellitus. Okay, Guillain-Barré syndrome. First of all, diabetes, polyneuropathy, syndrome, and the chronic inflammatory demyelinating polyneuropathy. Mononeuropathy, polyneuropathy. Polyneuropathy is the most common type. Then coming to the mononeuritis multiplex. Multiple mononeuritis are there. There are multiple mononeuritis in mononeuritis multiplex. The types of neurons affected. They can be motor neuropathies, motor neuropathies, sensory neuropathies, autonomic neuropathies, motor neuropathies, sensory, autonomic, and sensory motor neuropathies. This is again the most common type. Based on the most common type was polyneuropathy, and based on type of neurons affected, these are sensory motor and sensory neuropathies are the most common type. Okay, after the pathology affecting the nerves, based on the pathology affecting the nerves. They can be demyelinating neuropathies, such as example, CIDP, which is chronic inflammatory demyelinating polyneuropathy. Chronic inflammatory demyelinating, chronic inflammatory polyneuropathy, acute inflammatory demyelinating polyneuropathy. Then axonal neuropathies. Then we have axonal neuropathies, such as Aman and Thompson. Aman and Thompson. Okay, axonal, they can be Aman and Thompson. Aman, acute motor neuropathy, and acute motor and sensory neuropathy. These are both axonal neuropathies, acute motor and sensory neuropathies. Okay. So now, repeat the neuropathies, neuropathies are inflammation or degeneration of peripheral or cranial nerves, which results in impaired conductivity of these nerves. Okay. Again, based on the number and distribution of the neuropathies, they can be based on number and distribution, they can mononeuritis, polyneuropathy, and then mononeuritis multiplex. Okay, mononeuritis based on number and distribution, polyneuropathy most common mononeuritis multiplex. Types of neuron based on motor, sensory, autonomic, sensory motor, sensory motor based on the pathology affecting nerves, they can be demyelinating, axonal, demyelinating, CIDP, and axonal can be Aman and Thompson. Neuropathic causes of neuropathies. Okay, now we have the classification coming to causes of neuropathies. Now causes of neuropathies. These can be of two types, acquired and inherited. 1 and 2. These can be acquired, most common, and inherited. These can be acquired and inherited. Acquired cause of neuropathies most common. Again, most common is diabetes mellitus. Is the most common cause. is nutritional deficiencies, drugs, cyanotic infections. In infections, we have poliomyelitis and leprosy. Poliomyelitis and leprosy. In toxins, we have lead. Last, abrasive neuropathies. Tubular monkeys. Okay, in acquired forms of neuropathies. Most common is diabetes, deficiency, then drugs, cyanotic infections, poliomyelitis, leprosy, toxins, lead, abrasive neuropathies, and also monkeys. Infection, poliomyelitis, leprosy, toxins, lead, abrasive neuropathies, and also monkeys. Okay, last inherited we have heritage and zoonotic neuropathies. Charcot-Marie tooth disease. We have Charcot-Marie tooth disease. In hereditary and zoonotic neuropathies. Okay, we can inherit zoonotic neuropathies. They have Charcot-Marie tooth disease. Hereditary is the autonomic. Process is hereditary and autonomic. Okay, then we can be hereditary and autonomic neuropathies. And hereditary motor neuropathies. Hereditary motor neuropathies. Note: overall most common causes. That is like the overall most common cause is diabetes mellitus. Then next coming to the topic diabetic neuropathy. Okay, so till now we studied classification and causes of neuropathies. Coming to just a quick revision of causes of neuropathies. The causes can be acquired or inherited. Diabetes mellitus, drugs such as INH and metronidazole, infections such as poliomyelitis, leprosy, nutritional deficiencies, B12, toxins, lead, compressive neuropathies, herbs, lumpies. These are one of these come under the acquired. Now in inherited, hereditary sensory motor neuropathy such as Charcot-Marie tooth disease. Okay, hereditary sensory motor neuropathy such as Charcot-Marie tooth disease is common, and hereditary sensory autonomic neuropathies and hereditary motor neuropathies. Okay, they are also common. Note: overall most common cause is diabetes mellitus. Now coming to the next topic, that is diabetic neuropathy. Diabetic neuropathy, it is a, what is it? Diabetic neuropathy. It is a microvascular complication. Okay, diabetic neuropathy is a microvascular complication, and there is 5 to 10 years of hyperglycemia for this microvascular complication to happen, and there is increased risk of amputation. The most common type is sensory motor polyneuropathy. Which is usually characterized by a glove and stocking distribution of sensory loss and weakness. Okay. Now, diabetic neuropathy, it is a microvascular complication which is seen in 5 to 10 years of hyperglycemia in a person, and there is increased risk of amputation. Most common type is sensory motor polyneuropathy, which is characterized by a glove and stocking distribution. Okay, glove and stocking distribution of the sensory loss and weakness. In this, there is a, just remember from the word diabetic neuropathy, glove and stocking distribution of sensory loss and weakness. Now coming to the next topic. Sorry, wait just a second. Now coming to the next topic, that is diabetic neuropathies only. Sorry, just a pictographic representation, okay, of different types of diabetic neuropathies. What just happened? Wait a minute. Where is the going? Okay, wow, I have to delete it. The layering is not good. Okay, I think we'll have to go by like this only. Sad. Oh, and about the USMLE series, I will be starting it when I'm at, most probably tomorrow. And I'll be covering whole pathopharma and pathopharma and micro in 30 days only, and those 30 days will be counted on weekends. Okay, next topic. Let's come to different types of diabetic neuropathies. The first one is large fiber neuropathy. First of all, just remember the names. Then small fiber neuropathy. First we had the large fiber neuropathy, then small fiber neuropathy, then proximal motor neuropathy, acute mononeuropathies, and entrapment. Okay, first of all, large fiber neuropathy and small fiber neuropathy, then proximal motor neuropathy, acute mononeuropathies, and entrapment. Okay, now let us see. Is sensory loss present in? Just a second. Large fiber neuropathy, there is sensory loss in fine touch, vibration, and proprioception. Just remember this. And the sensations are lost in the similar way only, like glove and stocking distribution. Okay, in distal parts of the hands and the feet. Then coming to small fiber neuropathy, sensory loss in pain and temperature is seen. Okay, and in small fiber neuropathy, no sensory loss from hand is seen, only from the stockings part is present. Proximal motor neuropathy. These are there is sensory loss again. Okay, there is sensory loss, but proximal to the distal parts. For example, on the shoulders and in the thigh region. The thigh region, in the shoulders. Sorry. Okay, then acute mononeuropathies. These are due to loss in any particular single we can say compression of a single cranial nerve. The most common cranial nerves affected are third. First of all, the most common is third, followed by the fourth cranial nerve. There is truncal involvement. Okay. Now entrapment. After entrapment, there is a sensory loss in nerve distribution. There is a kind of sensory loss in nerve distribution. For example, any kind of nerve can be entrapped. Ulnar, median nerve, and over here comes the lateral popliteal nerve. Okay, and the pain is present in all these. So the types of diabetic neuropathies are large fiber neuropathy, small fiber neuropathy, proximal motor neuropathy, acute mononeuropathy, and entrapment. Then coming to some of the hereditary neuropathies. In hereditary neuropathies, mainly the neuropathies are sensory in nature. For example, we studied over here. Mainly the neuropathies are hereditary sensory motor neuropathies. Okay, when we are studying the hereditary neuropathies. In hereditary neuropathies, we are going to study about the Charcot-Marie-Tooth disease 1, then Charcot-Marie-Tooth disease 2, Charcot-Marie-Tooth disease 3, and then Charcot-Marie-Tooth disease 4. First of all, coming to the Charcot-Marie-Tooth disease 1, it is the most common hereditary sensorimotor neuropathy, and there is a mutation in PMP22. It is autosomal dominant, and it is a type of demyelination type neuropathy. It is seen more in childhood than adulthood. Okay. CMT1. It is seen more in childhood than adulthood, and mutation in PMP22 is seen. CMT1 is related to, it is mainly a childhood disease, which is seen mainly in PMP22, and it is the most common autosomal dominant disease. Demyelination type of neuropathy is present. Now CMT2, it is mainly axonal. It is again autosomal dominant, seen in early adulthood more than childhood, and this CMT2 is axonal mainly. CMT3 is again autosomal dominant, and it is seen in infancy. Whereas CMT4, it is autosomal recessive, and it is seen in a range from childhood to early adulthood. Okay, CMT1 is autosomal dominant, CMT2 is again autosomal dominant, CMT3 too, and the CMT4 is autosomal recessive. CMT1, it is seen mainly in childhood, CMT2 is mainly seen in early adulthood, CMT3 in infancy, and CMT4 in a range from childhood to early adulthood. And Now, usually in CMT, okay, mainly CMT1, what do we see? Wait a second. Now, this is the image of a disease in which pes cavus is present. Okay, it is a hereditary neuropathy which is seen in Charcot-Marie-Tooth disease. Okay, mainly it is associated with CMT1. Now, what were the features of CMT1 disease? It is autosomal dominant. It is seen mainly in childhood. It is most common, definitely CMT1. Okay, mutation in PMP22, PMP-BY, and it is a demyelination type of neuropathy. And another sign that we see, first of all, in CMT or hereditary sensorimotor neuropathy, we see pes cavus, and then we see this. That is inverted champagne bottle leg sign. Okay, it is an inverted champagne bottle leg sign. Now coming to the diagnosis of neuropathies. In the diagnosis of neuropathies, the investigation of choice is nerve conduction study. Nerve conduction study is the investigation of choice. In this, a 10 gram of okay, so never mind. These are the people living in my corridor. They are just making some kind of disturbance. Just ignore that for some time. Okay, nerve conduction study. Wow, juniors can be really mysterious. Nerve conduction study. In nerve conduction study is investigation of choice, and in this, a 10 gram monofilament. Okay, a 10 gram monofilament or Siemens-Winston test helps in identification of LOPS, that is loss of protective sensations. Loss of protective sensations, and is not primarily intended for the diagnosis of neuropathies, and is not primarily intended for the diagnosis of neuropathies. Monofilament or Siemens-Winston test, it helps in identification of LOPS, that is loss of protective sensations, and is not primarily intended for the diagnosis of neuropathies. It is just used for LOPS. Okay, for the detection of LOPS. Now coming to the management. In management, we are going to treat the underlying cause as in case of acquired or inherited, and then protective care is required. No specific much treatment is there. And now an image of the monofilament or Siemens-Winston test, whatever the thing is. Here we go. This is that image of the test. Over here we can see monofilament, okay, of Siemens-Winston test helps in identification of LOPS. This is the nerve conduction study. Okay, so that's all.